Another positive change has to do with the return of elective surgeries. Our Lisa Sugar talked with Dr. Thomas G. Donkar, General Surgery at St. Luke's University Health Network at the Miners campus in Coaldale. He explains the restarting process and the safety protocols now in place.
The St. Luke's University Health Network resumed performing elective surgery and certain procedures on Monday, May 11th at our Pennsylvania facilities. Our hospitals are open, they're safe, and they're ready to treat you. The stay-at-home order, which you spoke of, was set into place to hopefully decrease the spread of coronavirus, and luckily in our area it was pretty effective. And our infectious disease experts have now determined that it is safe to proceed with elective surgery and certain diagnostic procedures with, of course, certain safeguards in place. The first and foremost is that all patients will be tested for COVID-19 prior to their procedures to ensure a COVID-19 free environment. In addition, if any patients who have a surgical procedure require that they must stay over in the hospital, they'll be placed on a floor that is free of any known COVID patients. Any nursing staff that's taking care of the patient will only be taking care of those patients, not any COVID-19 patients at the same time. And finally, all staff will wear masks at all times for their protection. We're eager to get started and continue to expand our elective surgeries. And elective surgeries in and of itself is basically surgeries that can be postponed without any danger to the patient. And now that we're able to perform surgeries, on an elective basis when it's a good time for the patient, then now we're able to go ahead and proceed because it's now deemed safe.
And like some examples of what elective surgeries are.
Things like diagnostic colonoscopies for colon cancer screening, things like hernias, which may or may not be symptomatic but bothersome to the patient but didn't provide any serious threat at the time. Lumps and bumps, cysts and lipomas and things of that nature that sometimes may even be deemed somewhat cosmetic, but the patient would like it done. So things that would not put the patient in any danger.
Are patients hesitant to go back because they still fear COVID-19, or are they willing, saying, I've waited long enough, I want to get that surgery done?
The latter. Patients are actually pretty enthusiastic about getting their surgeries scheduled. They are, so I can sense some hesitancy sometimes, but I think a lot of that goes away once we have a good discussion about the precautions we've put in place and, knowing that it's a safe environment and that, we want to keep ourselves safe as healthcare providers, but our first and foremost is the safety of the patient.
If someone is hesitant and they know that they've been planning to have a certain surgery, but they're like, well, maybe not right now, what advice would you have for them? What would you say to them to maybe ease their fears?
I would tell them, again, the hospital as a network in each individual facility has been deemed safe to proceed with elective surgery, and we take every precaution to make sure that we prevent any type of exposure to the healthcare providers or the patients. And that based on our infectious disease experts and the fact that we take precautions before, during, and after the procedures, that I think it would be safe to proceed and that they should go ahead and get their surgery scheduled.
Thank you, Lisa. And the doctor says extra precautions are also being taken in offices. All patients are screened and asked to wear a mask. There is a limited waiting area. Appointments have been spaced out and all staff is wearing masks.